Passions of all kinds tend to have remarkable effects on our psychology and emotion. However, music in particular seems to have some power over us all that evokes strong feelings, and we aren't sure why. Throughout history, there have been various studies about music. Music is believed to impact our mood, thoughts, and ideas, and in some ways, our body. There have even been studies that show that music makes us smarter. We don't know why. We do know that music can influence heart rate, blood pressure, and electrical muscle activity. Neuroscientists also suspect that music can build and strengthen nerve cell connections in the cerebral cortex, which is probably why listening to Mozart beforehand improves IQ test scores by 9 points on average. Music-induced pleasure also causes feelings of clarity, which significantly improves students' grades. This effect, which is called the Mozart effect, helps students to overcome cognitive dissonance, distress brought on by conflicting thoughts, beliefs, or ideas, by relieving stress. Advanced students who studied music were compared to those who didn't study music, and their scores were recorded for 5 years. During 2 years, they all studied music, and in the last three, musical study was optional for all the students. In most courses, results show musical studies improved performance. Three classes show statistically significant differences, and four are not statistically significant and require further study to confirm academic improvement. The results are shown here. This graph represents the mean grades of all the students in each course over each year. In most courses, results show that musical studies improved students' in-class performance. Despite some courses having statistically insignificant findings, the study still indicates that musically inclined students performed better than those who were not. Separate years of study are shown here, with different classes as well. The only classes where students did better in a year without musical study were history and French, and the differences were insignificant. But the largest improvement was in math, because music and math are interrelated in many different ways. Researchers believe the cause is music's impact on intelligence and working memory. Even more, studies indicate boosted spatial temporal reasoning, which is mental manipulation of objects or images, often without physical objects. This skill in particular overlaps significantly with mathematical ability. It also seems that musical concepts could help teachers and professors to introduce new mathematical concepts to students in advanced classes, which might make musical study a common part of math lessons in the future. For example, notes can be compared to math symbols, fractions are compared to musical intervals, and the trend continues to expand until tunes and scales are likened to numerical operations and formulas. Besides research and academic study, music seems to positively impact people's mood, social health, and sometimes their personality. For example, music makes contact between individuals, so it automatically engages social cognition skills. Furthermore, music evokes feelings that can help people modulate their emotions to be more similar and thus understanding of each other, which prevents conflicts or arguments between different people. Besides social research, music helps in the hospital. In 1996, doctors had given 10-stroke patients rhythmic stimulation for 30 minutes every day for 3 weeks. They found that the stimulation significantly improved their ability to walk steadily. Similar results were found in patients with Parkinson's disease. Pregnant women in delivery are half as likely to need anesthesia if they listen to music that they enjoy. A cardiologist in Michigan gave 8 patients going through open heart surgery a choice between a morphine drip or a regimen of rhythmic humming. They preferred the humming, and their stay was shortened by 4 days. Psychological tests indicated that patients who listened to daily music therapy for 12 weeks were less depressed and anxious, more stable and sociable, and had significantly brighter moods than other patients in the facility. Music therapy has also been proven to help patients manage their lives despite grappling with Alzheimer's and other neurological disorders. Music's help with neurological development is significant at all ages, as it helps with disorders and also helps with infants' brain development. This is especially significant when parents sing lullabies to infants. In a 1995 study in Louisiana exposed preemies to lullabies, which they found allowed them to go home earlier. Music therapy in university hospitals in Cleveland also boosted immune function in children. All this goes to show that music has incredible impacts on us all in some way or another. Next time you're having trouble with something, Maybe take some time and relax by listening to music that you enjoy. You might find that it helps.